Thank you. Good afternoon, everyone. Good afternoon. Yeah, it's nice to be here. Well, let me give you a little bit of background into this work. Doing this research actually came from a publication, an article I saw that says spanking is an adverse childhood experience and is abusive, spanking. And being raised in a typical African family, I know that children get spanked and it is not abuse. And so then they clamor for positive parenting, which has been in the open space for quite a while. And being raised in an African setting, you know that a number of children struggle with a lot of these subtle abuse and violence, which are part of our child rearing practices. And why do we do this? We believe in the context of the traditional values, how to enrich it, and then the intergenerational transmission of values and intergenerational transmission of abuse and violence, and parents coming from the background of, this is how I am raised, and I must train my children the same way, and also trying to instill discipline in the family. Another perspective is the fact that we are religious and spiritual at the same time, and we want to go by the religious injunction that says, spare the rod and spoil the child. So we believe in spanking. However, the international community feels that spanking is negative, is an abuse. So the harsh parenting strategies, as it were, are deeply ingrained in our traditional and cultural beliefs, and all the people in the society, in the community, can help discipline your child, spank your child in the neighborhood when they see your child misbehaving. And so, however, we know that some of these things can be implemented, and then it could have a mental health implication for the child. And then there comes the need to prevent the culture of maltreatment, abuse in the name of child rearing practices, in the name of instilling discipline. And there has to be a conscious effort to move away from corporal punishments of children into more positive way of rearing children. And so the concept about positive parenting, what are the indices to measure this? We look at positive reinforcement, realizing that even in the African context, children are raised from the context of children have to be seen and not heard. Children are not given the opportunity to express themselves in most cases. Then proactivity and warmth. Parents are sometimes seen as weak when they show warmth and affection, and then it's believed that children get spoiled, in quotes. Yeah, Then providing support, affection, and consistent non-violent discipline. Your friend could fall out with you if over and over he or she comes around to your house and your children does one thing and you don't give the spank, the pinch, the knock, and so on. So positive parenting is saying these indices of warmth, supportiveness must be seen and passed on to the children. And so the first study, which is, I must also emphasize that it is not funded, it's self-sponsored research, actually investigated the extent or the level of knowledge and receptivity, or that is willingness to practice, and the challenges of positive parenting practices in Southwestern Nigeria. And talking about Southwestern Nigeria, there are 6 states that constitute the Southwestern Nigeria. We randomly selected 3, that's Oyo State, Ekiti State, and Osun State, which has, this 3 study site has the similar socio SES setting. And then what were the things that we set out to achieve? We tried to look at, hypothesize that high knowledge of positive parenting practice will lead to higher receptivity to positive parenting, and that mothers will have higher knowledge. Of course, you and I know that mothers spend more time with children than their fathers. That mothers will have higher knowledge and would be more receptive to positive parenting strategies than fathers. And that younger parents would have higher knowledge and receptivity to positive parenting than older parents. Why is this so? This is so because over the years, the younger parents are more educated, and we feel that education will play a role, and then they are well exposed than the older parents. And then we're trying to, we hypothesize that intergenerational transmission of violence is reducing. And so people are more proactive in their parenting practices. And so the study was carried out in 2 phases. We have the phase 1, which was the quantitative study, trying to look at the knowledge, the receptivity, and the barriers to positive parenting. Then it's a mixed method because we also had the interview session with 36 parents, and 582 male and female parents were sampled. At the end of the day, we actually selected 100 mothers and 100 fathers from 3 local government areas, 1 local government area from each of the states of the 3 states. Then random selection, Oyo, Osun, and Ogun State. Okay. Then for the knowledge and receptivity, we used the multidimensional assessment of parenting scale. It was adapted and modified. Adapted in the sense that we looked at the item by item analysis, which items on the scale actually addressed knowledge and then the receptivity. Then after that, we had to break it down and do the translation, back-forward translation, so the context of what the parents within the locale would understand and what actually speaks to the culture of the people there. So it was that was used to get the knowledge and the receptivity. Now, what did we get? What did we find? We found that low knowledge and receptivity to positive parenting with practices. And then there was low knowledge and there was low receptivity to positive parenting practices. Then at the phase 2, we did a qualitative, that's supposed to be a qualitative, where we did a focus group discussion. And the focus group discussion had 5 major themes. We have the cultural belief system, disparity between parents and children, the socioeconomic demands and work-related stress, loss of extended family support system, insecurity and risk perception. Now, what this implies is the fact that younger parents they actually want to show positive parenting practices, but then there's the socioeconomic demand, which also makes them to be absent at home, and which also impacts negatively on their mental health. And so sometimes you have parents reactive rather than being proactive because they are under pressure. Then they are also not there to care for the children. Then the loss of extended family support system is that the society is becoming more individualistic rather than the communal and extended family support that we used to know, where people are there to take care of children on your behalf, even when you're not there. So you see that a lot of parents are going through a lot of pressure taking care of their children. The insecurity and risk perception is becoming more dangerous and difficult, leaving your children in foster care or in the care of neighbors and friends around because of quite a lot of other challenges there. Then the cultural belief system is that this is how I was raised, and then I should raise you the way I was raised. Those were the things that were discovered from the work. So we have this figure 1, parents' knowledge of parenting. We have the parent with knowledge, higher, parent without knowledge, fathers, based on gender, between fathers and the mother. Mothers tend to have more knowledge than the fathers. Then based on receptivity, mothers are more willing than the fathers to practice positive parenting. Then based on the age of the parents, we discovered that the younger parents are more willing, have more knowledge and receptivity to positive parenting practices. And then while the older parents have lower knowledge. Okay, then we went on further to look at the association of internalizing problems and well-being on early adolescent perception of their own parents' practice of positive parenting. And this study was actually based on ecological theories, that is the social parents, the social relationship, the social environment of the adolescent was the relationship of the children with their parents. And then we hypothesized that internalizing problems will be associated negatively with well-being, and that higher perception of positive parenting will be related directly and possibly to adolescent well-being. What did we find? Okay, we had 450 adolescents. We actually adapted the Alabama Parenting Questionnaire, the Revised Child Anxiety and Depression Scale, the Mental Health Continuum Short Form, and then we did a partial least square. And then this is the model. That's what we found from the result. And what's the implication of this? We found that higher perception of positive parenting practice by early adolescents was associated with low internalizing behavior. Of course, that's expected, and that's actually what we found, which means that children perceive that their parents practice positive parenting with them, have low internalizing problems, and then they have better well-being. Now, this also is an indication of the parenting practice intervention, because all of it dovetails into the fact that a lot of parents we need evidence-based research to drive home the fact that we need a parenting intervention to actually be able to drive positive parenting. So positive parenting is necessary to be able to nurture and improve parent-child bonding. And so we actually need culturally adapted and culturally sensitive parenting intervention to drive positive parenting practices in Nigeria and Africa. Thank you.